Every single day, millions of people over 60 are making a walking mistake so common, so ordinary, that nobody ever questions it. In fact, most doctors never bring it up. Most physical therapists never warn you about it. And yet, this one quiet mistake is slowly, almost invisibly, dismantling the very system in your body that keeps you upright, stable, and independent. And here is the dangerous part. You won't feel it happening, not at first. Balance doesn't disappear overnight. It erodes, quietly, gradually, until one morning you reach for something on a shelf, your foot catches on the edge of a rug, and everything changes in a single second. I want to help you make sure that day never comes. By the end of this video, you are going to understand exactly what this walking mistake is, why it becomes so much more dangerous after 60, what it is silently doing to your nervous system and muscles, and the specific changes you can start making this week to protect your balance before the damage gets serious. And stay with me, because the most important piece of information in this video is not at the beginning. It comes later. And when you hear it, I think it is going to change the way you think about every walk you take from now on. My name is Dr. Adam. For over 2 decades, I have worked with adults over 60, helping them stay strong, stay stable, and stay out of the emergency room. Balance decline is one of the things I take most seriously, because I have seen what happens when people miss the early warning signs, and I'm going to make sure you don't. Let's start with something that might surprise you. Most people think balance problems are caused by weak legs, or inner ear problems, or medication side effects. And yes, all of those things matter. But there is another cause that almost nobody talks about, a cause that is hiding inside something you do every single day, something that is supposed to be good for you: walking. Not walking itself. Walking is wonderful. Walking is one of the best things a person over 60 can do for their health. What I'm talking about is how you walk, because there is a specific pattern that millions of older adults fall into, gradually, without even realizing it, and that pattern is quietly training your balance system to fail. Let me explain what I mean. Your body's ability to balance is not a single system. It is actually 3 systems working together simultaneously. Your eyes track your environment and tell your brain where you are in space. Your inner ear monitors movement, tilt, and acceleration. And your proprioceptive system, the sensory network running through your muscles, joints, and connective tissue, provides constant feedback about where your limbs are and how they are positioned at any given moment. Think of it like a 3-legged stool. All 3 legs need to be strong and active. If one leg weakens, the stool becomes unstable. If 2 legs weaken, even a small push can bring it down. Now here is where the walking mistake comes in. As we age, especially after 60, many people unconsciously shift to what I call a protective gait. The steps get shorter, the stride becomes narrower, the pace slows down noticeably. People start looking down at the ground more often instead of forward. They stop swinging their arms as freely. They begin to shuffle slightly rather than lifting their feet with purpose. And I want to be very clear about why this happens. It is not laziness. It is not weakness, at least not initially. It is your nervous system trying to protect you. Your brain senses that balance has become less reliable, so it responds by shrinking your movement profile. Shorter steps feel safer. Looking down feels safer. Moving slowly feels safer. The problem, and this is the part that concerns me most, is that this protective strategy actually accelerates the very decline it is trying to prevent. Here is why that matters. Your proprioceptive system, that sensory network in your muscles and joints, only stays sharp through use. It needs challenge, it needs variation, it needs your body to move through a full range of motion on a regular basis. When you shorten your stride, you reduce the angle your hip moves through. When you shuffle, instead of lifting your feet, you reduce the ankle flexion your nervous system experiences. When you look down instead of forward, you remove the visual challenge that forces your balance system to stay active and responsive. In other words, the safer your walk feels, the faster your balance system learns to do less. And a balance system that does less gets weaker, month by month, year by year, until one day it simply is not strong enough to catch you when something unexpected happens. I had a patient named Margaret, 68 years old, a retired school teacher from the Midwest. Margaret walked every single morning, 30 minutes, rain or shine. She was proud of that habit. She thought she was doing everything right. But when she came to see me, she mentioned that she had started feeling slightly unsteady in the shower, that getting up from a low chair had become a little nerve-wracking, that she had tripped twice in the past 6 months, once on a sidewalk crack, once on absolutely nothing. When I watched her walk, the pattern was immediately obvious. Short steps, slow pace, eyes fixed on the ground 2 feet ahead of her, almost no arm swing, no heel strike, just a quiet shuffle. Margaret had been walking every day for years, but she had been walking in a way that was slowly starving her balance system of the input it needed to stay strong. The walks felt safe, but they were silently making her less safe. Does that sound familiar at all? Have you noticed your own walking changing over the past few years? Now let's talk about what this mistake is actually doing inside your body, because understanding the mechanism is what makes this feel real. Your brain contains something called the cerebellum. It sits at the back of your skull, and it is responsible for coordinating movement, timing, and balance. The cerebellum is constantly receiving signals from your eyes, your inner ear, and your proprioceptive system, and it is using all of that information to make thousands of tiny micro-adjustments every second to keep you stable. But here is the critical thing. The cerebellum adapts to the inputs it receives. If you regularly challenge it, if you walk with a full stride, if you navigate uneven surfaces, if you occasionally change speed or direction, it stays sharp and responsive. It builds what neuroscientists call cerebellar reserve, a buffer of functional capacity that protects you when something unexpected happens. If you consistently remove challenge, if every walk is slow, flat, predictable, and visually guided by the ground in front of your feet, the cerebellum adjusts downward. It does not maintain capacity it is not being asked to use. This is not a disease. It is not an abnormality. It is simply how the nervous system works. Use it or lose it is not a motivational phrase. It is a neurological reality. And after 60, this process speeds up considerably. The nervous system becomes less efficient at maintaining underused pathways. The window for recovery narrows. This is why the same walking habit that caused minimal harm at 55 can become genuinely dangerous at 70. Stay with me, because I want to tell you about another patient, and his story is important for a different reason. His name was Gerald, 74, a retired engineer from the southeast. Gerald had never thought much about his walking. He was active, he gardened, he played golf twice a week, but his wife had been quietly worried. She had noticed he seemed to lean slightly to the left when he walked, that his right foot dragged almost imperceptibly on carpet, that he had started holding the railing on stairs in a way he never used to. Gerald came in and we did a thorough balance assessment. His scores were well below where they should have been for his age and activity level. What surprised him most was that he genuinely had not noticed the decline. He felt fine, he felt active. He had no idea that his balance system had been quietly deteriorating for probably 2 to 3 years. This is the pattern I see most often. The decline is slow enough that people adapt to it without realizing they are adapting. They stop going to certain places, they avoid certain terrains, they skip activities that once felt natural. Each adaptation feels like a practical choice, but together they paint a very clear picture of a balance system under serious stress. Gerald started a specific corrective program. 18 months later, his balance scores had improved dramatically. His wife told me he walks like himself again. That was the phrase that stayed with me. He walks like himself again. I want you to walk like yourself again, or better. I want you to walk better than you ever have. So let's talk about what you can actually do. The first and most important change is what I call gaze correction. When you walk, your eyes should be forward, looking at the horizon or at least 10 to 15 feet ahead of you, not down at the ground. I understand why looking down feels safer, but your peripheral vision is actually better at detecting ground obstacles than your direct gaze. And when you look forward, you force your vestibular system and your proprioceptive system to manage your stability actively, which is exactly the challenge they need. Try this on your next walk. Lift your gaze, look ahead. Notice how different it feels. If it feels slightly uncomfortable or uncertain, that discomfort is actually evidence of how much your balance system has been underused. That slight challenge is the stimulus for improvement. The second change is stride length recovery. Consciously work on lengthening your steps. Not dramatically, you are not sprinting, but instead of a 12-inch shuffle step, aim for a natural heel-to-toe stride that moves your hip through a fuller range. This single change stimulates the proprioceptors in your hip joint, your knee, and your ankle simultaneously. It wakes up the sensory network that your balance system depends on. There is a reason I saved this third point for now, because it is the one most people miss completely. Arm swing. Most people over 65 who have fallen into a protective gait pattern have dramatically reduced their arm swing. Arms may be kept close to the body or held slightly outward for perceived stability, or simply not moving much at all. This matters enormously. Natural, reciprocal arm swing, where your left arm swings forward as your right leg steps forward, is not decorative. It is a functional counterbalance system. It reduces rotational stress on your spine. It helps your cerebellum coordinate timing across your whole body, and it actually improves the stability of every step you take. When you suppress arm swing, you remove a key stabilizing mechanism and increase the rotational work your core and lower body have to manage with every stride. Restore your arm swing deliberately. Let your arms move. It may feel unnatural at first if you have been suppressing it for years. That is normal. Within 2 to 3 weeks of conscious practice, it will become natural again. The fourth change involves surface variation. If every walk you take is on flat, smooth, predictable pavement, your balance system is only being trained for flat, smooth, predictable pavement. Real life is not flat, smooth, or predictable. Grass, gravel, gentle slopes, uneven sidewalks. These surfaces continuously stimulate your proprioceptive system in ways flat pavement simply cannot. You do not need to seek out dangerous terrain. Even walking on a well-maintained grass lawn provides significantly more sensory input than concrete. Start incorporating varied surfaces into your regular walks gradually and intentionally. I want to pause here and ask you something directly. Have you made any of these changes without realizing it? Have you started avoiding certain surfaces, shortening your steps, looking down more often? If you have, I want you to know that is not failure. That is your nervous system trying to protect you. But now you know that protection has a cost, and you have the information to start changing that. Let me tell you about one more patient, because her story shows what is possible even when the decline has been going on for a while. Her name was Dorothy, 79 years old, a former nurse from the Northeast. Dorothy had fallen twice in the previous year, once in her bathroom, once coming down her front steps. Her family was worried. Her daughter had started talking about whether it was time to consider a different living situation. Dorothy was devastated by that conversation. She had lived independently her entire adult life. The idea of losing that was deeply frightening. When Dorothy came to see me, she was walking in an extreme protective pattern, very slow, very short steps, almost no arm movement, eyes constantly on the ground. She was terrified of falling again, and that terror had intensified every protective adaptation to the point where her balance was actually worse than it would have been if she had fallen into these patterns more gradually. We worked with Dorothy carefully and progressively. Gaze correction first, just 5 minutes per walk, then gradually more. Arm swing restoration, gentle surface variation, and a specific home exercise program targeting the ankle strength and hip stability that are both absolutely critical for balance. 6 months later, Dorothy had not fallen again. 12 months later, her balance scores were better than they had been at her previous doctor's visit 3 years prior, and she was still living in her own home, still independent, still herself. That is what is possible. Even at 79, even after 2 falls, even when the decline feels advanced. I want to ask you to do something now. In the comments below, I want you to tell me, when did you first notice a change in your walking or your balance? Whether it was a slight hesitation, a trip, a moment of unsteadiness, or something a family member pointed out. Share it below. You would be surprised how many people have noticed the same things and feel alone in it. You are not alone in it. Now, I want to give you one more piece of information that I think is genuinely important. Everything we have discussed so far has been about the mechanical and neurological aspects of walking and balance. But there is a psychological dimension to this that is just as real and just as powerful. Fear of falling, even in people who have not yet fallen, physically alters how people move. Studies have found that adults who are fearful of falling walk more slowly, take shorter steps, and have significantly worse balance scores than adults of the same age and physical health who are not afraid. The fear itself creates the movement pattern that increases the risk. It is a self-fulfilling cycle. Breaking that cycle requires two things. First, the practical corrections we have already discussed. Second, and equally important, a gradual rebuilding of confidence through intentional progressive challenge. Not reckless challenge, progressive challenge. Choosing to walk on slightly varied terrain. Choosing to lift your gaze. Choosing to lengthen your stride by just a little more each week. Every small success is a signal to your nervous system and to your psychology that you are capable of more than your fear was telling you. You are capable of more. That is not a slogan. I have seen it proved in my clinic over and over by people in their 70s and 80s who decided they were not done yet. Here is your challenge for the next 30 days. Every single walk, I want you to do 3 things. Lift your gaze forward, let your arms swing naturally, and take at least one portion of your walk, even just 2 or 3 minutes, on a surface that is not flat pavement. That is it. 3 things, 30 days. No gym required, no equipment needed, just your attention and your intention on every single walk. If you found value in this video, I want to ask you to subscribe to Dr. Adam. I put out videos every week designed specifically to help adults over 60 stay strong, stay balanced, and stay independent. The work you are doing by watching and learning, it matters, and I want to keep supporting it. And before you go, in the next video, I'm going to talk about something that surprises almost everyone who hears it. There are 5 specific foods that most people over 65 eat regularly. Foods considered healthy, foods that appear on every recommended diet list, that are quietly undermining the neurological function your balance system depends on. Not one person in 100 knows about this connection. I'm going to break it down clearly and completely, and I'm going to tell you exactly what to eat instead. You will not want to miss that one. The goal is not perfection. Nobody walks perfectly. Nobody has perfect balance at every age. The goal is understanding what your body needs, understanding what your daily habits are actually doing to your systems, and making small, consistent changes before small problems become serious ones. You are not powerless in this. Your balance system is trainable. Your nervous system responds to challenge at every age. The decline that feels inevitable is, in most cases, largely preventable, and in many cases reversible. All it requires is the right information, applied consistently. You now have that information. Use it on your next walk. Your future self is counting on it.